Hello and welcome to today's video. Today we are going to talk about wounds. Understanding wounds and their classification is essential for healthcare professionals and anyone interested in maintaining good health. This topic is very important for your examination point of view from theory as well as practical. And this video will also help you in your clinical practice so that you can predict the complications, infection rates and the other related things about the wounds. By the end of this video, I am sure you will be able to classify the wounds and you will be able to know when to classify, how to classify and why to classify. So let's dive right in. Firstly, what exactly is a wound? A wound is a break in the integrity or continuity of the skin or tissue which may be associated with disruption of structure and function. It can range from a minor cut to a severe injury. Now let's see what is the difference between wound and an ulcer. In the ulcer, there is discontinuity of the skin
mucous membrane,
but there is also molecular depth of the tissue. Now let's explore the classification of the wounds. Wounds can be classified in many ways. Let's see each of them one by one. First is the based on the cause or etiology. Incisional wounds. These are caused by sharp objects or instruments resulting in clean and straight cuts. It includes penetrating wounds. It commonly occurs due to the stab injury. For example, stab injury of abdomen. The stab wound may be small on the body surface, but the damage to the deeper organ like liver, spleen, major vessels like inferior vena cava, mesenteric vessels or intestine may be extensive and it can be life-threatening. Now the second one is the laceration wounds. Irregular jagged wounds caused by tearing of skin, often seen in accidents or animal bites. Third one is the abrasion wounds. Superficial wounds caused by friction or scraping against a rough surface causes abrasion wounds. Fourth one is the puncture wounds or bites. Narrow, deep wounds caused by pointed objects penetrating the skin like stepping on a nail causes puncture wounds. Another one is the hematomas. Hematomas are caused by damage to blood vessels that in turn causes blood to collect under the skin. Different classifications are based on the size of the hematoma. Hematomas that originate from an external source of the trauma are called as contusion and they are also called as bruises. It may be subcutaneous, intramuscular, subfacial or intraarticular. Small hematomas will get absorbed automatically, but the large hematomas, once they get infected, they form abscess and needs active management. Now the next etiological type of wound is the traction and avulsion injury. Another one is the crush injury. Crush injury is caused by war wounds, road traffic accidents or tourniquets. It leads to compartment syndrome, muscle ischemia, gangrene or loss of tissues. Another etiological factor is the war wounds or gunshot injuries. Injuries to bones, joints that can be open or closed wound, injuries to nerves, injuries to arteries, vein or injury to internal organs are different etiological factors that can cause wounds. Fractures. Fractures can be classified as either open or closed depending on whether the integrity of the overlying skin either disrupted or preserved. So this was all about the etiological classification. Now wound can be broadly classified as acute or chronic based on the time from the initial injury or progression through the normal stages of the wound healing. So here wounds can be acute or chronic. Another type of classification is based on the depth. These are categorized as superficial wounds. When there is only outer layer of the skin is affected, such as minor cuts or scrapes, then it is called as superficial wounds. Partial thickness wounds, they involve the deeper layer of the skin, but they do not penetrate through all the layers. Whereas full thickness wounds, they extend through all the layers of the skin and sometimes involve the underlying tissues or organs. Now the next type of classification of the wound is also called as rank and Wakefield classification. They have categorized them as tidy wounds, which means they are the wound like surgical incision or wound caused by sharp objects. Primary suturing are done for this and healing is by the primary intention. Now the next one is the untidy wounds. Untidy wounds can be caused by crushing, tearing, avulsion or devitalized tissues or vascular injury, or there can be multiple irregular wounds, burns, fractures. These all come under the untidy wounds. Wound adhesions or infection or delayed healing are common in such type of untidy wounds. Now the next type of the classification is depend on the complexity. They are categorized as simple wounds when there is only skin is involved, whereas complex wounds they involve skin along with vessels, nerves, tendons or bones. Now depending on the integrity of the skin, they are classified as closed wounds. Closed wounds are contusion, abrasions and hematomas, whereas open wounds where there is loss of integrity of the skin, they are incised wound or lacerated wound, crush injuries or penetrating wounds. So these were the different types of classifications. The most widely accepted wound classification, which was first introduced in 1964 by the National Research Council to describe the degree of bacterial load or contamination of the surgical wound at the time of surgery. It was subsequently adopted by the US Centers for Disease Prevention and Control to classify the wounds. They are basically classified as clean, clean contaminated, contaminated and dirty wounds. Although the simplicity of this classification has led to its widespread use, the definitions are not entirely clear and low inter-observer reliability has been reported. Now we will have an in-depth look into this surgical classification of the wounds. Basically, this classification is based on the wound sterility. Wound sterility or degree of contamination of the wound is critical while we consider evaluation of the wounds. The CDC's surgical wound classification system is most commonly used for classification of wound sterility, specifically within a surgical setting. According to this classification, 4 different classes of the wound exist, each with their own perspective risk of surgical site infections. Now the first one is the class 1 wounds. Class 1 wounds are categorized as clean wounds. These type of wounds are not infected, so they do not exhibit any signs of inflammation and they are typically closed one. It is worth noting that the class 1 wounds or clean wounds do not involve respiratory, alimentary, genital or urinary tract. Examples of clean wounds include an inguinal hernia repair or thyroidectomy, surgeries of brain, joints, heart transplants. Infection rate is less than 2% in clean wounds. Now coming to the class 2 wounds. Class 2 wounds are categorized as clean contaminated, which means they have a low level of contamination. These type of wounds involve entry into the respiratory, alimentary, genital or urinary tract, but only under controlled circumstances. For example, appendectomy, bowel surgeries, gallbladder and biliary surgeries. So here the infective rate is approximately 10%. The class 3 are contaminated wounds. An open accidental wound resulting from a trauma outside of a sterile setting is automatically considered as a contaminated wound. Additionally, any surgical wound where there is a major break in the sterile technique or obvious contamination from the gastrointestinal tract is considered as contaminated wound. For example, acute abdominal condition or open fresh accidental wounds. Here the infection rate is a bit higher and it is up to 15 to 30%. Now the fourth class is the dirty wounds. These injuries usually occur from inadequate treatment of traumatic wounds or gross purulence or pus, or there is evidence of infections. When tissue lose the vitality, It can lead to class 4 wounds. This is often caused by surgery or microorganism found in the perforated organs. For example, if we are doing abscess drainage or pyocele or empyema gallbladder, or if we are dealing with the fecal peritonitis cases, these type of wounds are considered as class 4 or dirty wounds. Here the infection rate is approximately 40 to 70%. Clinical significance of proper wound classification lies in its ability to help predict the likelihood of surgical site infection, post-operative complication and reoperations. Treatment strategies of the wounds will vary depending on the classification of the wound. Therefore, it is essential that wounds be thoroughly evaluated by students and doctors for proper management. Correctly classified wounds can potentially aid in assessing mortality, morbidity, and quality of life. Each type of wound requires specific management and treatment to promote healing and prevent complication. It's crucial to assess the wound carefully and tailor the intervention accordingly. Now, let's have a quick synopsis of the wound classification system. In the etiological classification, we have clean surgical wounds, shearing or degloving wounds, crush, blast, burn injuries like thermal, electrical, chemical, radiation or mechanical injuries, cold injuries, avulsion or tractions, low or high energy wounds, and the bites. Depending on the depth, it can be epidermal, dermal, full thickness wounds. Depending on the contamination, it can be clean, contaminated, and dirty. Sometimes we have to specifically see if there is any implant inside or it is a non-implant type of wound. Depending on the complexity of the wound, it can be either simple wound or it can be complex wound. The complex wound, they involve the significant tissue loss, or it can have open fracture or joint or visceral organ involvement. The wound can be complicated one, and the complication can be infection, necrosis, hematoma, gas gangrene or compartment syndrome. So this was all about the wounds and their classification. We hope you found this video informative and engaging. Don't forget to like, share and subscribe for more health related content. Stay healthy and take care. See you in the next video. Thank you very much.